Hello, my name is Rachel and I'm going to be demonstrating how to do an IND of an abscess. So some indications for doing this is if you have a localized collection of pus that's not resolving spontaneously. The signs of infection include pain, fever, redness, swelling, and loss of function are usually present with an abscess. So what are some contraindications to an IND? Facial furuncles should not be incised or drained if they are formed within the triangle from the bridge of the nose and the corner of the mouth. They need antibiotics and warm compresses. Abscess that occur near the rectum or genitalia should be addressed by a general surgeon. Patients with diabetes, debilitating diseases, or compromised immunity should be observed after an IND of an abscess. Some complications that can occur are cellulitis or recollection of pus. Perianal abscess INDs frequently result in a chronic anal fistula and up to 50% of the time in adults. An abscess in the palmar aspect of the hand can extend from superficial to deep tissue via the palmar fascia. So let's get started on this IND.
No.
Okay, so you want to make sure you have your alcohol wipes, 1 or 2% lidocaine without epinephrine, 19 to 22 gauge needle, 304 towels for drapes, number 11 or number 15 scalpel blade and the scalpel handle, Kelly clamps, Adson forceps, curved hemostats, 4x4 inch gauze pads, sterile gloves, 500 mLs of normal saline solution. You want some gauze strip to pack the wounds, bandage, scissors, and dressing of choice to cover the wound. Alright, so we want to apply a single layer of betadine, or in this case I have alcohol wipes, on the abscess here. And then you want to use a regional fill block approximately 1 centimeter away from the erythematous border of the abscess around the perimeter. So I am using lidocaine, about 5 mLs, and I'll go ahead and do the fill block. Okay, so you want to kind of go around the abscess. I'm inserting in and inserting the lidocaine as I pull out. And I have the consent from the patient and they are aware of everything that I'm doing. And the last final side. Alright, and then you want to wait approximately 5 to 10 minutes for the lidocaine to actually take place. Then we can properly drape the abscess. And we want to make the incision along the Langer lines. So pause it.
No.
So you want to make the incision above the abscess. Come in a straight line across. Sometimes. Okay, so sometimes it lets a little bit out as you're doing it. And then once you cut it, you want to squeeze and make sure you get all of that purulent drainage out of there. Squeeze around. And then you want to get your hemostats. And you want to make sure that you break up all the material and stuff that's in here. And then see if any more comes out. Oh, there's a little bit. Okay, and now you want to thoroughly irrigate the abscess with normal saline before any gauze is inserted. So I'll just grind some in there. Okay, just gonna slightly pat it a little bit. And then you want to insert the iodoform gauze into the abscess with 1 centimeter of gauze exiting from the cavity. So you sort of just work your way in. And then we'll just leave a little bit out. And then we can apply sterile dressing over the abscess to absorb drainage and prevent foreign materials from entering the wound. You can just put some tape around. Try to hold it down. You want to advise the patient to keep the wound clean and dry. Instruct the patient about how to remove the dressing 2 days after the procedure, replace with a dry, sterile dressing, and change it daily. Instruct the patient to watch for signs of recurrence of the abscess for further infection as cellulitis, and instruct the patient to notify the clinician immediately if any of the following occurs: recollection of pus in the abscess, fever, chills, increased pain and redness, red streaks near the abscess, and increased infection in the area. All right, guys, that's it.